Hi guys, welcome back to Future Horizons. Today we have with us a very special guest, Lene Murad, who has a degree in healthcare administration and is currently the Cope Junior Health Scholar Program Manager for across three different locations. Thank you so much for your time, Lene Murad. We're super excited to have you.
Thank you for having me, and I'm excited to be here.
Thank you. So what inspired you to pursue healthcare administration?
Good question. So I knew when I was in high school that I wanted to do something healthcare related. I wasn't quite sure. It was interesting because I had friends that seemed so confident that they were pre-med all the way. Like I know I'm gonna go to this school, I'm gonna become a doctor, I'm gonna do this, or I'm gonna be a nurse. But I was like, I don't know what I want to do because I know I want to be in healthcare. So I was like, okay, maybe pharmacy is like a good path. So initially, after taking chemistry in high school, I liked it. So I was like, oh, maybe I'll do pharmacy. And then I my first year in college, I was undeclared for a major because I just wasn't sure what I wanted yet. And I took another chemistry class. It was significantly harder. And then I took a bio class, also very hard. And it was harder. I noticed that it was harder on me than other people. And I realized like bio and chem just weren't my strong suits. And if I was already feeling like exhausted and overwhelmed by some of the more basic like science classes, and that's just the beginning of the career path of what it takes to be a doctor or a nurse. I was like, okay, maybe, and pharmacy as well.
Hmm.
I was starting to think maybe I shouldn't do this. So while still being undeclared, I started taking a management class as well as an econ class. And I loved those classes. I thought I was really good. I was just really understanding how economy worked as a whole and like how like supply and demand and just like project management, managing people, what are stakeholders and stuff like that. So it's just something that definitely definitely got my attention, but I still wanted to do something healthcare related. So at the time, I was at UCI, UC Irvine in Southern California. To do business, it was very math heavy, and I just didn't know if I wanted to necessarily do business because I definitely wanted the healthcare aspect and I prioritized that
Hmm.
more. So luckily, UCI has a major called public health, and fortunately, it's becoming more and more known. But at the time, it was still somewhat of a new major, and I decided to do it because with public health, you could do so many different avenues. You could pursue policy if you were interested. You could pursue health education. You could then go on to get your master's in healthcare administration, which is what I ended up doing. And then you could also, even after studying public health, you could end up applying to medical school and going to pursue your career further through there. So I was like, okay, I think I want to do public health so that I could pursue a master's afterwards in healthcare administration. And so I did that. So I got the chance to take a bunch of public health courses while also taking management courses on the side. I took Management 101. I took business and medicine classes just to really understand ways that both healthcare and business can be ingrained in one another. And it was just very fascinating to me. Um, Shortly after graduating, I got a job at a health plan, and I did that for about a few years. And then during my time working full time for this health plan, I decided to apply to a bunch of schools in Southern California to study health administration. And fortunately, I got into USC, which was my ultimate dream
It's an
school.
amazing school.
Thank you.
Yeah.
It was just my dream school. And what I liked about USC is they were very passionate about teaching you five different parts of healthcare administration, like healthcare finance, healthcare IT, health operations, data analytics, and there was something else. I forgot, maybe something policy related. So I was like, oh wow, this is great. I get to pursue all these different things and get the chance to sort of like figure out exactly what I could see myself doing. And so I did that for 2 years, and I realized I narrowed it down afterwards that I want to do operations. So healthcare operations is like where I really lean towards. And I'm just very grateful. It's been a few years since I graduated, and I've had about 6 years of healthcare experience overall, somewhat related to healthcare operations. So So essentially, I'm glad that I chose health administration, and that's what made me sort of choose it.
That's really cool. How would you say, how is public health as a degree? Is it like a difficult degree in terms of like the classes you take?
I would say it's not too difficult, honestly. I think you learn a lot of different things like health education and environmental health, like the importance of the environment around you and why like parks need to be near you, why like a city needs to have certain things to function for people's for the overall health of the public. And so I think it's not too bad as long as you study. There is some math that is, I think I took up to calculus 2 with my degree. So, but nothing after that. And um, a few, a few basic science courses as well, anthropology and stuff like that. But overall, I would say it's maybe 7 out of 10 in terms of difficulty.
Not too bad. That sounds pretty cool though. I love your inspiring journey.
Thank you.
What does a typical day look like for you managing the Cope Health Scholar program across three different locations?
That's a good question. So I started out in Seattle. Initially, there was a site there. Um, and then afterwards, I ended up sort of, the site ended up closing down. So now I'm just supporting three different sites in Tacoma, Portland, and Spokane. And I really like it. I think I'm a huge extrovert, so I think that's what helps. And just, I love getting to talk to people. This is definitely, when I applied for this job, it was definitely like a dream because I knew that this was something I want to do. Getting the chance to talk to people, and work with high school students and college students about their, sort of be a mentor to them and support them in their journey of healthcare is just something that has always been really fun for me, honestly. I would say like my typical day to day is a lot of just answering frequently asked questions, doing a lot of recruitment, because we obviously want to spread the word about our program and let them know when our applications are and stuff like that. A lot of it's also hosting interviews, so interviewing the next set of health scholars or junior health scholars and seeing how they do. Um, so that's just like a little bit of like what my day to day is. Sometimes things get added on randomly last minute, but that's how it goes in operations. You're kind of just walking around and there's always going to be something that's going to be added. Um, but yeah, I think overall I've helped a lot of juniors and health scholars. And something that really sticks out to me is when a junior health scholar once told me that they initially came into the program knowing they wanted to do healthcare, but they weren't quite sure what it was. But after being placed in different units every rotation and then getting placed specifically in the mother baby unit, they realized they love working with babies and moms. And so they realized after that rotation that they want to be a pediatrician. So I think just hearing stories like that really like warmed my heart. That like knowing that this program is giving people the opportunity to sort of figure out exactly what they want to do. And I think like I'm really grateful for this opportunity that it exists because I know a lot of people sometimes, and I've heard stories like this where they pursue being a doctor because they know that it pays well, but that's all they really know. And then right in the middle of med school, they realize, wait, this is actually not what I want to do. After seeing blood or seeing like pa dealing with patients, they're like, wait, I don't think I can actually do something like this. So I'm glad that this program is a very like low stakes environment for you to really see if this is something that you actually want to do in the future. Um, and it's okay. It's totally okay to join this program thinking that you want to do healthcare and maybe like being like, oh, actually, this isn't what I want to do.
It wasn't
So
what I expected, yeah.
yeah, yeah. So, and for me personally, I am very queasy around blood. I cannot do it. So that's another added reason of what made me choose healthcare administration. Um, so yeah, that's like a little bit of my day to day and what it's like managing this program.
It's a beautiful feeling to help like so many kids like discover the passion and everything. And it's an amazing program because I know a lot of other like hospitals and things, they don't really let high schoolers really or like, even many college students actually like be close to the patient. So it's a really nice like you get direct patient contact and I think it's a really great feeling and it's a really cool program.
Thank you.
What are some of the biggest challenges you face managing such a large program such as the Cope Health Scholar program?
Yeah, so I touched upon this earlier, but I really want to elaborate. Sometimes you have like a clear set direction of what you're supposed to be doing, and then something gets added on last minute. Like whether my manager says, "Oh, we actually need to complete something really quickly that's due this week," or whether a scholar comes by and they want to file a complaint against another scholar or a staff member, or we find out that another scholar was committing timesheet falsification. So there's a lot of like different challenges when it comes to like my role as a program manager. Just it, the crucial thing in this role is just being organized and having a to-do list, and I think like that's what's been helping me. I think I would say like a pretty big challenge that is very topical right now is there are some scholars that join the program because their parents want them to join, and because of that, they end up not really committing to the program, whether they just show up to their shift for the first 30 minutes and then maybe just like take the rest of their shift in the cafeteria, or they feel like they're not really supporting the staff, or they don't know how to support the staff, so then they kind of just sit around, secretly go on their phone. So I think that's just been a really big challenge of just motivating our scholars to not do that and making sure that if this isn't something that they want to do, and if it's something their parents sort of putting upon them, then that they are allowed to withdraw and that they don't have to force themselves and waste everybody's time from doing that. Because it doesn't look good for the hospitals to see like our program is having scholars not really do the work that they are signing that the client is paying for essentially. So I would say that's been like a really big challenge lately, especially in Tacoma. So that's just probably something that comes to mind.
No, it definitely is a challenge because I feel like you'll have many students who are there, they might be doing it for their resume filler or like a college application, like something that stands out. But at the end of the day, it's an experience that's meant to like be enriching for the participant and it's meant to benefit them directly. It's not really, it's more than just like something you put on your resume. So,
Exactly, yeah.
how's your background in public health and health administration help prepare you to manage such large programs such as the COPE Health Scholar program and past programs you've managed before?
Ooh, a really good question. So when I'm thinking back at my time studying public health at UCI, there were so many like soft skills that I learned that I still use to this day, and I'm very like grateful for it. I had this professor named Professor Schmidt, and I took like 7 classes with him throughout my time at UCI because he was just a really good professor. And his main focus was to ensure that all his students know how to do really good presentations, building slide decks and presenting. Because he always used the example, what would you do if you were presenting to a board of executives about a program that you want to initiate? How would you do that? And so being in doing studying public health, you learn sort of like how to develop a project from start to finish, develop the timeline, the scope. We also learn what a SWOT analysis is, which is essentially a table that has strengths, weaknesses, opportunities, and threats. So it's a great way to sort of look at a project from the outside and think realistically what it would look like, what opportunities can come from it, what are some weaknesses, like what are some things that we need to work on. Um, and then what are opportunities that could come from this project and like down the line, not just like right after, but sort of a year down the line, 2 year down the line, whatever the case may be. My Professor Schmidt was also very specific about slide decks. Like I remember I'd get annoyed because like one slide deck would have Arial font and the other one would have Times New Roman, and he would dock me down like 10 points for that. And I remember being annoyed. I'd be like, it doesn't matter. Like, at least the quality of the slide is fine. Why does it matter if the
If the
font is
font is
different?
off, yeah.
Yeah. But I realized over time that is actually something that's so important. Aesthetics are so important because if it shows that you're paying great detail in the slides that you're presenting and that you're showing to a leadership team, that means that you've clearly given it a lot of thought, you've done a lot of research, and you are good at paying attention to detail. So if the font looks big in one slide and small in one side, that shows the team that you're presenting to that you're not really you're not good at paying attention to detail,
Mm.
or you're not as
Serious enough
passionate
about
about
it, yeah.
this. Yeah, yeah, exactly. So that's something that I learned in public health, and it genuinely, like, I build slide decks all the time now. I'm presenting at recruitment events. I'm sometimes presenting to leadership at Cope Health Solutions for initiating new ways to make the Health Scholar program better. And in order to do that, I need to have had this degree because it's so crucial to know how to build a project from start to finish and present it, and also building those people skills and presentation skills. A big part is just like learning to captivate your audience, right? Because if you just talk and talk, or if you're just reading off a slide, the audience won't be as engaged, right? So it's so important that you keep your slide deck pretty small, especially with this new generation, with Generation
Yeah.
Z and stuff like that. Like ADHD is a real and prevalent thing. And if your PowerPoint slide has just a bunch of bullet points and that's hard to sort of decipher or like really ingrain in you, then it's not going to stick with them. But if it's maybe two or three bullet points and then you elaborate while you're talking, that's like a great way to sort of captivate the audience. Also, slide number one and two, I think, are super important because that's how you like garner the audience's attention in the first place. So even if you start with like a fun activity or an icebreaker or something, or like something along the lines of raise your hand if you've had this issue.
Hmm.
And then let's say they raise their hand, then you can be like, well, I've had this issue too. Let's talk about what we can do to fix it. And then we go over that. So that's like just like a little way that can affect the whole presentation and how the audience feels about your presentation. So I would say like that's probably the biggest
No,
like
that
help.
makes sense. Would you say this might be a tough question, but would you say your degree in like your master's in health administration or your degree like bachelor's in public health has helped you more like manage your programs, or what do you think has, I don't know, been a bigger asset in a way, if that question makes sense?
Ooh, that's a good question. They've both helped in very different ways. So I talked a little bit about how UCI, my public health degree, helped me. In terms of my master's in health administration, I learned a lot about data analytics and Excel, and also accounting. So I think at the time before starting, I thought I knew Excel. I was like, oh, I know how to use Excel. It turns out there's so many things you can do with Excel that people don't know about.
Crazy
There's
the
like
amount of stuff you
tables.
can do.
Yeah, you can build tables, graphs. Based off how much data you have, you can create a whole story with graphs and be like, look, a certain percentage of scholars have been helping the staff through XYZ or something like that. So I think my master's has really helped me really ingrain what data analytics is, how data can help serve and show proof of growth or even proof of failure. It can just show different things, especially when you add unique identifiers to your data, like race, gender, um, and like stuff like that. That way you can sort of get an example of like, oh, could there be a variation in between the two like identifiers? Um, maybe there's some sort of connection to whatever the person identifies as versus what the data is showing. So you can really work with data in so many different ways. And so I will say that's how like my health administration um, degree has helped me.
That's pretty cool. It does teach you a lot.
Yeah.
What's been your favorite role being in healthcare administration, public health so far, and why?
I'd have to narrow it down to two roles because
That's fine,
they're
yeah.
both, yeah, I equally like both of them. So I talked a little bit about being a program manager at Cope Health Solutions and managing the Health Scholar program. That's definitely one of my favorites for sure because I love working with the newer generation and being a mentor. So definitely that. And then another one I'd probably say I used to work for Optum, part of United Health, as a senior project coordinator in the mergers and acquisitions department. I really, really enjoyed that one as well because it's very project focused and you get to work with different clients. So for instance, in that role, whenever we had So our clients were essentially physicians that were looking to retire who had their
Mhm.
own practice, but they were like, oh, well, I'm about to retire and I don't have anyone else I can sort of hand this down to. So I'd like Optum to sort of buy us out. And so with that, we'd sort of absorb that office when they're ready for it. So with that, obviously comes a lot of paperwork, a lot of contracts, and meeting with the client on a biweekly basis to make sure that the acquisition is going really smoothly. So I thought that was probably a really great job to have because I really liked working with a really good team, and getting the chance to speak to different clients and understand what their needs are. Like some would be like, I really want to make sure my staff remains the same. I don't want you guys to hire new staff. Or I really want my office to be located here. Like certain things that we want to make things work within the contract, just reviewing and editing contracts and making sure the project timeline is being completed in a timely manner. So starting off from the beginning of like establishing what the timeline will look like from the first day versus the last day, which is when acquisition will take place. And a really something I really like about this job was that
Mhm.
we we had different measures to show whether or not this acquisition was successful. And one measure was patient satisfaction. So are the patients just as satisfied with the new, like with the new owners as they were before? Or are they even more satisfied? Same with like, and then another big measure was member retention. Or yeah, member retention as well as um, employee retention.
Mm.
So making sure that like there's still a good amount of members that still go to that physician office despite the fact that it's been acquired by a new entity. So or if have we gained even more? And then another one, obviously, like I said, patient or employee retention. So did the employees still stay despite the fact that a new entity has taken place, probably a new management? Um, and if so, then that's another measure that this acquisition went well. So like different things like that. So and then we don't just measure it right away, but we measure it up to 2 years down the line.
Oh,
So we
right. It's like a long-term kind of thing.
yeah, exactly. So that way we can show that data to new clients and be like, well, these are some of the recent clients that we've acquired, and this is what the data shows. Member retention's good. Patient satisfaction's through the roof. Member retention, risk adjustment. There's a bunch of different measures that we have, and that's when like I mentioned earlier, Excel. That's when Excel and data analytics really comes into play because it's kind of hard to sort of look at data itself and be like, I don't know what I'm looking at. But
Yeah.
if you can change it and turn it into a graph that's easily readable to the client, um, that's like a way that they can be like, oh, okay, I see it. That's
I see
really
what's,
good.
yeah. It's pretty
Yeah.
cool. I had a follow-up question. So like during that role in Optum, what strategies did you find like most effective in maintaining like the staff members and like maintaining customer satisfaction or like patient satisfaction even?
Good question. As long as we have a lot of conversations before the acquisition officially happens, making sure like what is the biggest priority that the employees have, and what are some things that we should keep in mind about your specific physician office, your specific site has to make sure that we're improving things? Like, what are some weaknesses you've noticed? What are ways we can improve it? So just having those really in-depth conversations, especially when reviewing the contracts, is a way that I've noticed has been successful in terms of getting people to everyone to be happy because that's what we want. We obviously want a
Exactly, yeah.
success rate. So yeah.
That's pretty cool. I would never have thought of these things. So it's really cool to get to know like the behind the scenes work that goes on in healthcare.
Yeah,
'Cause I feel like that's
yeah.
something that most of us are just not aware about. So that's pretty cool.
Mhm.
What advice would you give to high schoolers and college students interested in healthcare administration and public health?
Ooh, okay. I have several advice, and this is advice that I wish someone told me. So I hope that it can help someone else. First and foremost, I know it's hard, but really do try to pay attention in class. I think like education is so valuable, especially when you get to college. So really, like, you are paying for these classes, even if you get a scholarship, this is all like money. And it's really, you're not ever going to get an opportunity, like, you may not get an opportunity like this again to have the chance to get a really good education. So just really pay attention, and you'll get the chance to get like context on why things are the way they are and understand the world a little bit more. So definitely would recommend that, especially if it's a class within the field that you plan on taking.
Mhm.
So for instance, if it's like a writing one class, do whatever you want. But I would just
Yeah.
say, like, if it's like something that you know that will help you in your future career, please try to pay attention. That's like advice number one. Um, Number two, once you're in college, see if there are internships available near you that are in the field that you're interested in. Like, for instance, the Health Scholar program, if you're
Mhm.
interested in being doing clinical care, like nursing or being a doctor. But there's a lot of other opportunities and internships available if you want to do business. There are some business internships you could look into. It's just so crucial because I mentioned this earlier, but doing something that's low stakes now is so much better than investing a lot of money and time into a career and then realizing much later down the line that you don't want to do it. And while, of course, that happens to some people and that's totally
Mhm.
fine, if there's a way that you could prevent doing that, that's ideal. So definitely see if there are ways that you could ask your parents if they know anyone that has, if they have any friends that are, holding internships for different types of careers. So if you could do that, that's just like really, really crucial, I think, to do. So you can see what it's like to do that.
Getting experience is critical.
Yes, getting experience is critical. Seeing what it's genuinely like on a day-to-day basis and not just like the idea of it.
Like the
Or not just
glorified version of stuff, or like the, I guess, what social media shows you about role and seeing what the nitty-gritty really is.
exactly,
Yeah.
exactly. And I've heard this saying so many times, but like it's not like Grey's Anatomy.
Yeah.
Especially like if you're doing something like nursing or doctor, it's not gonna be like as dramatic or romantic. Like it's real people, there's real stuff going on, there's blood, there's a lot more other like gross stuff that you deal with. And if you're not equipped for that or it's not something you could see yourself getting used to, then definitely a way to pivot. Also, like there are so many other healthcare focused careers that don't involve being doing clinical things like what I'm doing right now. I get to inadvertently help people while still doing sort of office work
Yeah.
and working a basic 9 to 5. I don't have to work nights. I don't have to work like weekends and odd hours. I get to comfortably work and do things. And there's a lot of also work from home opportunities in healthcare. So if that's something that you could foresee yourself doing, but you also still want to do healthcare, definitely look into health administration. I think that's something that can also go so many avenues because you can, if you realize you're really good at math and accounting, you could be a financial analyst for a hospital.
It's
And
pretty cool.
yeah, that's a really cool job. It's a great way to make really good money, and be comfortable in your career. So there's definitely a lot of opportunities like that. Lastly, I want to say if you haven't already, make a LinkedIn
Mm.
and really try to make as many connections as you can. While you're in college, especially, it's a great opportunity to reach out to people. If you come across someone's profile on LinkedIn and they're in a career that you want to see yourself doing, that you want to see that you want to do, you can always, it doesn't hurt to message them and be like, do you mind if I interview you? And just get an idea of what you do because that way you can ask them as many questions as you want and it's not weird. They'll most likely really want to talk. Like,
They'll be
they'd love,
happy to help. Yeah.
yeah,
And I
they'd be
think the
happy to
worst thing
help.
they can say is no. So,
Exactly. Or not respond,
or
which is
not
fine.
respond or be like, I'm sorry, I'm busy. So,
Yeah, yeah. So that's like probably my last advice. Get a LinkedIn, form connections, try to see if you could message people to in your career field that you're interested in. So yeah, before you officially invest, that's like my biggest thing.
that's some golden advice.
Thank you.
Yeah, no
Oh,
worries.
also want to
Yes.
mention
Yeah,
the,
no
the
worries.
decision you're making at 18 to 22 is likely the decision that's going to affect adult you, 30-year-old you, 40-year-old you, 50-year-old you. So it's really important to really think about it and don't choose your career on a whim. And yeah, that's all.
Like, know that, think about what you're going to do seriously because
Yeah,
you're going to stick with it most likely.
yes,
Thank you. Thank you so much, Lene Murad, for your specialties and your advice and everything. It's really going to help us. Thank you.
of course. Feel free to add me, follow me on LinkedIn. If anyone else that's listening that has more questions for me and wants to meet with me, I'm more than happy to meet. So feel free.
Thank you. Until next time, Future Horizons. Bye.